Alright, hi everyone. Uh, so we're going to do the last little bit about the cardiovascular system. We're going to go through blood pressure. So today you're going to check out some notes, work on one of those homework sheets. On Thursday, practice a little bit more with blood pressure itself. And then you are going to do like a Google assessment next Monday. So this is pretty much it. I want to be able to move on from here and go to the respiratory system next. Okay, so blood pressure and then Google form assessment, which I'll put up a type of study guide on Wednesday on Google Classroom, just so you kind of understand the topics that it will be on. Okay, so here we go. Let's talk a little blood pressure. All right, blood pressure. So this is the pressure your blood exerts against your blood vessel walls as your heart beats. So this makes sense. So, you have these tiny long tubes that going throughout your body called the arteries and the veins. Arteries are bringing blood to the body from the heart. So your heart pumps out nice, fresh, oxygenated blood from the heart through the arteries to the rest of the body. Veins are bringing all of that deoxygenated blood back from the body to put back into the heart so that way it can go back to the lungs and get more oxygen. Okay, so this is measuring how much pressure is being exerted on those vessels. The highest pressure is going to be exerted in the pulmonary artery and the aorta, right? So we know the aorta is our giant big blood vessel that comes out of the heart that gives pretty much all of your body its blood. So it has a very, very important job. So there's a lot of pressure put on that. So it's really important to understand and know like the aorta's blood pressure. So there are two different really types of blood pressure because it kind of goes with our phases of the heart, which we talked about last week. So the pressure of the blood against the artery wall while the ventricles are contracting is our systolic blood pressure. Right, so when the ventricles, the bottom chambers contract, you have systolic blood pressure. Normal range is between 100 and 120 millimeters per mercury. That's what that mmHg stands for, millimeters per mercury. That's how we measure blood pressure. So systolic is the first sound you hear, right? Because that's part of that lub-dub beat, again, talked about last week. So our first type of blood pressure is going to be our systolic, right? Ventricles contracting. And then our second type of blood pressure is for the diastolic phase, right? So this is going to be the pressure of blood against the artery wall while the ventricles are relaxing. So diastole, the ventricles are relaxing, and your atria are the ones actually contracting. So the normal ranges for this one is going to be between 60 and 80 millimeters per mercury. So it's noted when the sound stops or becomes very faint because, again, the ventricles have now relaxed. They're not going to be making any noises from the valves opening. Right, so these are these two numbers that you normally always get with blood pressure readings, right? You always hear like 120 over 80. So your 120 was the systolic blood pressure and the 80 was the diastolic blood pressure. All right, so how is it actually measured? So again, like I said, it's measured in millimeters of mercury or millimeters per mercury. And you're going to use our stereotypical blood pressure cuff, right? So what happens is, and we've all experienced this, you go to the doctors, they ask you to roll up your sleeve, and they put on the blood pressure cuff. The idea is that it increases pressure on the inside, it squeezes on one of the larger arteries of the arm, and then is measuring your pulse, right, as air is being let through to see how much pressure is actually being exerted on on that particular artery. So it gives a clue into how your blood pressure is, right? Another tool that we have to use for measuring blood pressure is the stethoscope, right? We've all probably seen one of these, and if not, played around with one. So it's used to listen to the heartbeat, right? So you're listening for the systolic contraction of the ventricle, and then diastolic is when you're noting that faint pause when the sound disappears, right? So they're actually really cool. If you get a really good stethoscope, they are very very sensitive instruments, so you have to be careful. So a lot of times, like, here's the end part of your stethoscope, it's called the drum, and it has a sheet on the top of it called a diaphragm. you got to be careful. So you might see people tapping it, right, just to make sure that you can hear through it. You can actually hurt somebody's ears pretty bad if you like yell into it. It's actually very, very sensitive because it is trying to pick up your heartbeat, which can be very faint. So you got to be careful, but they're very, very cool. And if you get a chance to kind of mess around with one, you can hear a lot of different noises. You can put it up to different organs. It doesn't just have to be the heart. You can put it up to your stomach and you can actually hear maybe your stomach churn, which is kind of cool and gross. All right, so recording. So we record it in the form of a fraction. Again, the systolic number over the diastolic. So again, my example before was 120 over 80. It could be 120 over 70. Again, the 120 is your systolic. Your 70 is going to be the diastolic. Again, here's your units, millimeters per mercury. All right, so then you also have your pulse pressure. This is the difference between the systolic and diastolic blood pressure. All right, so you just take the difference between those two numbers and you're getting your pulse pressure. Right, so every time that heart beats, you know that's your pulse. The normal range is between 30 and 50 millimeters per mercury. And this is important because it helps to indicate health and tone of your artery walls, right? Is your heart working correctly? Is your arteries pumping and receiving blood correctly? Or is things weak? Is there a blockage? So your blood pressure and pulse pressure are very important tools we use to make sure that the body, especially the cardiovascular system, is still doing its job. So we have a few different things that could be abnormal. So pre-hypertension. This is a warning that high blood pressure is likely to develop. Note the likely, right? Pre-hypertension. The pre means that it is possible, it might be coming. This condition can harden the arteries, dislodge plaque, and block vessels that nourish the heart. So you gotta be careful because plaque can build up. It's kind of like this thick growth. Think about like plaque on your teeth, right? Imagine this stuff kind of clogging up these very, very tiny tubes, and it could end up ruining the passage of blood to the heart, and it could be very difficult. So pre-hypertension is where the systolic number might be a bit over 120 to about 139, and your diastolic's about 80 over to 89. Again, this is pre-hypertension, just meaning that your body is having a little bit difficulty, and this is like a warning sign. You might want to go to the doctor if things kind of feel like, you know, your body's overworking, right? Your heart's working a little extra hard lately. People tend to feel like a little lethargic, so that could be pre-hypertension. And then you have actual hypertension. This is where your pressure is greater than 140 millimeters per mercury, and that's not good. High blood pressure means that there is a lot of work being done. A lot of causes could be like stress. That could be happening to a lot of us right now. What's going on? You know, having a very high blood pressure because you're constantly stressed out and your body buckles really terribly under stress. So that can cause the artery walls to be doing a lot more work and your heart to be doing a lot more work. Being anxious, nervous, having a high salt intake. Salty foods can increase your blood pressure. Not good. That's why mom and dad always advise us to be careful with all of our salts. Advanced age, it is something that can just happen. You know, as the body gets older, these things tend to happen. It is a natural thing to occur. Thyroid disease, smoking, and doing any kind of drugs. That could be, you know, anything from certain medications. There are medications that their symptoms could cause high blood pressure. So you have to be careful. And have to be careful that this isn't a prolonged thing. You know, again, the stress, the anxiety, that might cause temporarily a high blood pressure number, which can then go down. Very easy to, you know, deal with. But you don't want to see a prolonged time period with high blood pressure. Again, it means your body's working way too hard. It's putting in way too much energy to get that blood out to the rest of the body. Not good. And then our opposite, we have hypo. So the other one's hyper, this is hypotension. This means you have low blood pressure, right? So it indicates when the blood pressure is less than 90 millimeters per mercury. Common causes could be heart failure, dehydration. Dehydration's a big one because think about it. Water is mostly found in your blood and it has to be cycled through everything. So if you are dehydrated, you don't have that medium that carries everything around. And that can cause the low blood pressure, right? Almost like things are becoming a tad bit lazy. Blood's not getting pumped out enough. This could be caused also by shock, severe burns, depression. So severe burns is an interesting one to really talk about because A lot of times people think of like when you're burned, you know, it has a lot to do, like your skin's going to be affected the most, blah, blah. But again, you're damaging vessels that are close to the surface of your skin. So when you're damaging them, it could have an effect of causing low blood pressure, meaning that the blood's having a difficult time getting to where it needs to go in a reasonable time period. So it's very interesting how a lot of these things can be caused by just your current status mentally. It doesn't always have to be something physically that can alter how blood is actually distributed through your body, which I think is kind of crazy. But anyway, so this is really, really cool. So I am going to post up the homework sheet I want you guys to do now. For anyone who is still stuck with me right now, I'm going to have you do a homework sheet that is not the next one in the order in which we gave them to you, just because we're running out of time. So I'm just going to have you do the one on blood pressure, and then that's it. So we're not going to do the rest of them. We just don't have the time. I don't want to spend too much more time in the cardiovascular system when we technically still have 2 other systems to get through. I'm hoping to at least to get through the respiratory system. Maybe hopefully we can like get a little bit of the urinary system in there. All right, guys. So look for that post. Thank you so much. I hope your Monday goes amazingly. Okay.